thank you so much for joining us at Abu Dhabi Global Health Week.
Thank you, Hadley.
Walk me through how you see longevity and Abu Dhabi as a destination for healthcare executives.
Honestly, Hadley, I think there's been just so many interventions that Abu Dhabi has done in such a systematic manner over the last 10 years. So it didn't start with a longevity agenda, right? The first thing that Abu Dhabi did more than 10 years ago was talking about mandatory insurance. How do you first get to basic healthcare for everyone? Make that equitable, right? So I think that was so important, and spending like 5-10 years getting that model right. But in the last 3-4 years, a lot more discussion around genomics. What does our code look like? How should we be thinking about what our genetic makeup is? And then what next in the world globally in terms of longevity? So if you look at the world as a whole, it's so interesting, right? In the last 100 years, we have added 25% of life expectancy. We're talking about 78 years as the average life expectancy right now. But what is really sad with that also is that while you've got the increased lifespan, you're also decreasing your health span. So how much of your life you're actually spending in ill health? So I think everyone's looking at this magic formula, right? And to be honest, Hadley, my simple theory on this is there are a lot of technological advances. There are a lot of things on genetic code that we're working with, stem cells, which is all very interesting and exciting. But to a large extent, it also boils down to the basics. So the information's there, analytics is there, you've got so much data that is getting crunched. But how do you actually make sure that people adopt those and actually change your behavior? So I think we need to do both, because you've got a young population that you have to make sure that you're feeding them the right things so that they don't end up in a position that maybe, our parents are in. And we're at the cusp as a middle generation where, our parents are sort of, you're seeing what aging does to to any of us as individuals, and are able to take corrective action, saying that instead of having to deal with bad health for 10 years of my life, do I really want to deal with bad health for the next 40 years of my life? Of course not, right?
Yeah. What do you think about Abu Dhabi's role going forward?
So I think Abu Dhabi has taken on a very, the region, to be honest, whether it's Abu Dhabi, whether it is in GCC, when I look largely, even at Saudi, I think both of them have become very powerful voices when it talks about longevity. And it cannot be one country's agenda, right? I think what I love about even this conference is there is representation from everywhere around the world to say, okay, what is at a WHO level, what are the macro conditions that we are grappling with? Two of the biggest issues our world is facing is climate change, health, demographics. And we need to solve this not as just a nation. We need to come together and put the best minds together to be able to find these solutions. What we are now doing is partnering with technology firms. We're partnering with medical devices firms, saying that how can I do better screening? How can I do better diagnostics? How can I do better prediction for the future? And all of us have to come together to find a solution. It cannot happen just me saying I'll do it, right? It's government, private, all the other stakeholders coming together to kind of co-create that solution. And Abu Dhabi's vision of being the most intelligent health system where, you're really kind of able to talk about great quality of life for somebody who is living to be 80 and 90 is a phenomenal vision. And, we're very excited to be part of this ecosystem.
In your mind, what is the role of the pharmaceutical industry?
Yeah, so I think I was listening to an interview by Google DeepSeek CEO, and he was talking about how it takes a PhD, his full pieces, to find the structure of one protein. And there are 200 million proteins. So you're talking about billions of years to do that work, right? Now with what data and deep work and analytics can do, you're able to do that in a fraction of that time. So I think what the big pharmas are doing, there's a lot of exciting work in terms of being able to accelerate bringing drugs to market, which I think is going to make life hopefully better for us as we think about the future.
And when you think about longevity, it's become a bit of a buzzword, but what does it mean to you?
For me, it's about bringing my full potential and being able to live my life holistically and happily. And it is that sum total of our roles that give us that longevity, making it worthwhile, to be honest.
It's wonderful to have you here in Abu Dhabi. Thanks so much for joining me.
Thank you.